for a universal, publicly funded healthcare system. And I advocate for that for a number of reasons. First of all, we know that in places in the world, to the extent that healthcare is paid for privately, or any social services are paid for privately, to the extent that that becomes the pattern, health services are delivered inequitably. If we want equal treatment for our population, and I think that the people of British Columbia and the people of Canada support equity and accessibility, then we need to advocate for and support publicly funded universal health care. The second reason that I support, and again this is about healthcare, but it's also about all social services, has to do with democracy. When we fund healthcare and manage healthcare publicly, then we together make the decisions about what our priorities should be. To the extent that those services are paid for privately, it begins to become the market that determines what the healthcare or other social service priorities should be, and the market is determined not by need, by health need, but by those who have money. And so it seems to me very important as a public policy principle that we want to be democratic, and therefore we need to provide these as services, not as commodities.
Mm-hmm. And, can we afford that?
Well, we can't afford not to have quality, publicly funded healthcare for our people. And clearly the people of British Columbia agree. If you ask them, as we have done, as independent pollsters have done in numerous polls, what's the most important issue in this coming election? What do you care about? What do you think is central to the election? They say healthcare, and they overwhelmingly support publicly funded healthcare. We can't afford not to take good care of the health of our citizens.
What is your choice and why?
Well, again, we need to look at two systems. First, the post-secondary system, and it's very clear that over the last 2 or 3 years, post-secondary fees have doubled and more in British Columbia. The impact of that, there's one fundamental impact of raising the fee-for-service model of funding of post-secondary education in British Columbia. The impact is to make it more difficult for students who don't have money to go to school, and to place a burden on them and everyone else who goes to post-secondary education to pay with debts that they carry with them after they're finished, if they manage to finish after they finish school. That policy, in my view, is wrong. The NDP has made it clear that that we will reintroduce a freeze on fees in higher education. And as for myself, I'll always be an advocate for reducing fees at the post-secondary level, because the result is only one thing. It's to make it harder for those kids, or for those young people, and some older people who go back to school, to be successful as a result of not having enough money.
So I hear you saying increase funding for education. From how much to what much would you be expecting to increase that?
Well, I don't make policy. We're not the government. We're just moving towards a situation in which we want to replace a government that's underfunded education to the tune of hundreds of millions of dollars every year.
The Liberals claim that they are increasing the budgets for education.
Yeah, well, that's we understand, and certainly parents and students understand the manipulation of that claim, and it's very, very important that we remember. Let's remember that it was Mr. Campbell and the then Minister of Education, Ms. Clark, in the winter of 2002, who said that their policies would put students first. We're going to put children first, and we're going to build the best education system in the world. And the result of their policies, as we predicted, We're not happy that our predictions were correct, but as we predicted at the time, the results of their policies would be closed schools, rising class sizes, fewer specialist teachers, less support for students with special needs. So they claim that the funding has increased, but let's look at it carefully. Fixed costs have gone up. The funding has basically stayed the same in terms of the dollars, but the costs that have been required of school boards to spend money on, for instance, the imposed settlement, salary settlement of teachers, not funded by the provincial government. For instance, increased accounting, pension, medical costs that amount to hundreds of millions of dollars, not funded by the government. So the costs that school boards have been required to expend have not been funded by the government, and the result has been that services to children have been reduced.
So you're saying the services have been reduced because the budget from the government has been reduced?
Absolutely.
So how do you square this when they say that they have increased? You say they have reduced.
They've reduced funding by forcing school boards to spend a chunk of the money that they receive from the government on elements of the budget that haven't been funded. So, for instance, the government imposed a small salary increase in the last set of negotiations with teachers. They imposed that contract. It wasn't negotiated, wasn't part of free collective bargaining. It was imposed and legislated in Bill 27 of January 2002. That costs school boards money. The government didn't provide that money, so where's it to come from? School boards were in an impossible situation. The government claimed another phrase that the government used to use only 2 years ago. We heard it every day. We're providing flexibility. We're providing choices for school boards. What are the choices? Close schools, increase class sizes, reduce services to students with special needs, close down libraries. Those were the choices that school boards had, and in some cases they had to choose all of them.
Which one would be your choice and why?
You know, I don't pretend to be an expert on welfare, and it's one of the questions that I don't feel comfortable answering. I know I have some general impressions about the issue, and I know that we need to provide for people to live, for our neighbors. People who are on welfare, we have to remember, are our neighbors. They're not some other breed or alien group. They're people who live near us. We have to provide for them in a way that allows for people to live comfortably and in dignity. But I don't feel comfortable answering policy questions on welfare.
Would it be fair for me then to say that you would click on the circle on nowpolling.ca where it says, I don't know, I don't have enough information?
I think so. I think that's the safest click at the moment.
All right. Which one would be your answers if you were to vote nowpolling.ca?
I'm opposed to privatization of public services. I will always be opposed to privatization of public services. It's inefficient. It's financially counterproductive, and it's undemocratic in my view. These are assets and resources that belong to all of us. They need to be managed and provided in a way that takes account of all of our needs. The only way to do that, in my view, is through an accountable, publicly managed system.
Would public-private partnerships be a little friendlier, perhaps?
I think public-private partnerships are a euphemism for privatization. It's just another way of saying privatization, and I'm opposed to those when it comes to the public, to those assets, to those services, to that wealth which we own together.